Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.
You're listening to Healthcare Matters, the podcast that pulls back the curtain to help you make sense of complex healthcare economics and policy issues. With us, as always, is the incomparable Dr. Robert Popovian, joining us from Washington, D.C. You know he's a pharmacist, he's an economist, and he's the Chief Science Policy Officer at the Global Healthy Living Foundation.
And joining me is my good friend, Conner Mertens from Seattle, Washington, my co-host and our numero uno community outreach manager and patient advocate extraordinaire.
Robert, I'm really excited to be back, and we have a special guest today, my good friend and colleague, the brilliant Shilpa. And we're going to get right into this episode.
So yes, let's welcome our dear colleague, Dr. Shilpa Venkatachalam. Welcome aboard, Shilpa. Why don't you briefly introduce yourself and tell us what you do at Global Healthy Living Foundation?
Sure, and thank you, Robert and Conner, for having me as a guest today. So my name is Shilpa Venkatachalam. I am the Director of Patient-Centered Research and Ethical Oversight at the Global Healthy Living Foundation, where we do what's called patient-centered research. And that means we bring the patient voice to the table in all the research that we do. I'm also someone who lives with rheumatoid arthritis. I was diagnosed in 2017, so quite a few years back, but not that long. And I've, of course, cycled through several medications for my own treatment. I've gone through a diagnosis, a misdiagnosis, and then back to another diagnosis. So again, it's very nice to be part of this conversation.
So I would like to make it clear to our audience, Shilpa's here today not to talk about her job, and she does great work at GHLF, but she's here today as a patient who has a very interesting story to tell regarding the real-life trials and tribulations patients go through in certain states with regards to acquiring vaccines. So Shilpa, tell us what happened, because you and I have talked about this, and you've explained it to me, and I would love our audience to hear it from you firsthand.
Sure. Goodness, every time I have to talk about this, I really get fired up because it was one of, I don't want to say the worst experience, but close to it. So as you know, with conditions like rheumatoid arthritis, there's an increased risk of contracting infections. This is an established fact. But my story today, Robert, is not really about the availability of vaccines or the need to take them, especially if, like me, you're living with a chronic condition, chronic underlying condition, you're taking medications that may suppress your immunity. Today, my story, and I'm really eager to share it, and so thank you for having me again, is about how, despite the availability of these vaccines, many of us who actually need it are unable to get it because of the many system-level barriers. And you can see already my emotion is starting to peak up because I just relived this entire thing every time I'm retelling the story. So, as a patient, it's really frustrating enough to have to deal with chronic pain, to have to deal with chronic fatigue, doctor's appointments, x-rays, imaging, blood work, medications. And then on top of all that, when you have to deal with roadblocks over and over again to get something that you need, that your doctor has recommended to you, that guidelines have recommended, it's really actually quite demeaning, frustrating, a waste of time, and discouraging when you're not able to get it. So let me give you an example. I had to recently get the shingles vaccine, and I'm talking about the Shingrix, not the Zostavax, because I initiated a certain treatment for my rheumatoid arthritis. And I just want to say I've been through this before, so it's not the first time I've tried to access Shingrix. I gave up last time because of all the roadblocks. So this time I was determined as hell to find a way to get that vaccine because I needed it. And I was also plain fed up because I knew what was coming. So there's sort of a mix of emotions. And this medication in particular that I was supposed to start for my rheumatoid arthritis, it increases the risk of shingles for those on it. And hence the recommendation is to get the Shingrix vaccine before you start the medication. And I want to say this at the start. I'm not pointing fingers here at anyone. Everyone in this play that I'm about to talk to you about was wanting to help, right? They all wanted to help. But the problem is that every time I tried to get access to the vaccine, there was always a roadblock. So I don't know how much in detail you want me to go into my story, but honestly, if I don't go into the detail, you might not be able to grasp the gravity here. So I was advised to get the vaccine, and so off I went to the pharmacy to get it, right? I hadn't started my new rheumatoid arthritis medication because I wanted to get the vaccine at first. So I went to the pharmacy and I got told at the pharmacy, it's not possible. You're not 50. We can't give it to you. You're not eligible, is what they told me. They said the system, and by the system, I'm guessing they meant the computer, pointed out that you're not 50 and hence there's no eligibility. And so we can't administer it to you, is what I was told. And I was thinking, well, my RA is not going to wait until I'm 50 to progress. So I tried to explain to them that I had rheumatoid arthritis, that I was immune compromised because of the medications I was taking, and that I was eligible to get the Shingrix. And in fact, my doctor had recommended it. I explained this to them over and over again, and they understood. And they said, we understand what you're saying, but we're not able to administer it to you. Fine. I called my doctor's office. And they said they'll send a note and a prescription, which actually the pharmacy said, ask your doctors to send us a prescription. So they did. The pharmacy got a hold of the prescription. Initially, they insisted that the prescription had not come through, but it eventually did. They got the prescription. And now that they had the prescription, I was thinking, okay, great, all sorted, let me go back. So I went back to the pharmacy and I asked them, you have the prescription now, can you give me the vaccine? And they said, well, we have the prescription. We can give you the vial, but we can't administer the vaccine to you. So I was like, hang on, so how am I supposed to? And I asked them, I said, how am I supposed to give the vaccine to myself? And they said, we're really sorry, the system is not allowing us to administer it to you. Maybe ask your doctor or another clinic or a hospital to give it to you. At this point, I'm thinking, fine, just stay calm and go to the next steps. I called up about 5 or 6 different clinics. Each clinic told me they can't administer a vaccine from outside within their facility. So I called up the hospital where I was being treated for my own care, spoke to my team. They found out from their nurse practitioners, and they got a notification from the hospital that they could not administer the vaccine for the same reason, that this was an outside vaccine that was being brought into their property. So now I'm thinking, okay, I have the vial, I have the injection, I have people who know how to give a vaccine, and yet I can't get the vaccine. That's how frustrating and unbelievable this whole thing is. So I called everyone again, the pharmacy, the hospitals, the clinics, my doctors, my care provider team. And again, everyone's trying to help and see what's going on and why I'm not able to be given this vaccine. Eventually, honestly, I don't know what happened eventually. But at one point, the pharmacy called me and said, you can come, we can give you the vaccine. And that's how it all happened. And I just want to say before I stop that all these delays, it's one thing that the vaccine, I spent hours and weeks, I'm not kidding, weeks to get this vaccine that I should have got very easily. And all these delays with the vaccinations meant delays to initiate my treatment for my rheumatoid arthritis. And so I went into flare after flare. I was put on opioids. I was put on painkillers to control my pain. I was not able to sleep. I was not able to work. I was frustrated. I was under a lot of mental and emotional distress because I had to travel back home to India in a few weeks. And I couldn't without the vaccine because I couldn't start my medication. And seeing all this, everyone, my family, my friends, were all frustrated because they were seeing what I was going through. So that's my story in a nutshell, and I'm sorry to go into so much detail about it.
No, Shilpa, thank you so much for sharing. And that really does sound like some sort of horror story and completely unfair. And, it sounds like at times we make it more difficult as opposed to less difficult for patients to acquire vaccines in the United States, especially something like this, which is so clearly needed for you. And while it's also delaying your care, can you expand on that a little bit more?
Sure. And I couldn't agree more, especially after having gone through this. And I'm, as a researcher, I'm someone who works on vaccines and the importance of vaccines. But after this experience and my previous experience accessing the Shingrix, having vaccines available is one thing. But there is no use having something in stock and then having multiple barriers to accessing what's in stock. I was absolutely shocked that getting a highly effective preventative medicine, a vaccine, wasn't easy or quick. I expected that I would walk into a pharmacy, get vaccinated, and then move on to the next step, which is to start my treatment. Because we get told over and over again, research tells us, don't delay your treatment, right? Your outcomes are going to be worse if you delay your treatment. So I was doing everything right as a patient could. I'm working the system here, trying to get that vaccine, trying to start the medication, which is what we constantly tell patients. Navigating insurance to gain access to the medication that my body needed at that point, right? I was doing everything I could. What I realized eventually after many weeks of fighting, and again, I'm not fighting against one person. I'm not saying this is one person's fault. In fact, what I realized was this wasn't a person-related fault at all. I began to see how many ways my frustration as a patient running around in circles was in vain, because it isn't that people involved don't want to help. If it was one person, you can solve that problem. But here, it's a system-level fault. We live in a healthcare system that is severely fractured and that poses a barrier at every step of the way to the patient. It's not the onus of the patient to spend hours, weeks, trying to get access to something that they should be given. And then we talk about vaccine hesitancy. We have no right to talk about vaccine hesitancy when we make it so difficult at every step of the way for patients to gain access to what they need. So every attempt falls like a house of cards, and we have to start all over again. And at some point, honestly, it's easier to just give up. And I was close to doing that too.
Yeah, Shilpa, thank you so much for being so candid and honest with your experience. And I'm just so sorry that you had to go through all that. And Robert, we talk about vaccines on this show often. We're very pro-vaccine and understand its importance, like Shilpa mentioned, as a preventative care technique. So another thing that we discuss is what can we do about it? What is the solution here to make sure patients don't have to go through this hell that Shilpa went through of all these hurdles that are currently in place to get this preventative care, such as immunization?
So Conner, Shilpa's story is not unique, but it is self-reflecting of the problems that we've talked about on this podcast for many, many months or years, actually, about why do we make it so hard for patients to access the most cost-effective intervention in the medicine, which is vaccination. And Shilpa ran into several things on her way to acquiring the vaccine. And one of the first things is that she lives in the state of New York. So in the state of New York, pharmacists are not allowed to administer all FDA and CDC recommended vaccines or CDC recommended vaccines. They have to go about only administering vaccines that are on a list that is put out by the state. Now, there are several states in the United States that allow pharmacists, as soon as the vaccine is FDA approved and or CDC recommended, to administer those vaccines. New York happens to be not one of them. So hence, starting the problem starts with the state level requirements regarding regulation of who and at what point can they and what vaccine can they administer to the patient. So in the state of New York, patients such as Shilpa, if they're 19 years and older and immunocompromised, the pharmacist is allowed to administer the shingles vaccine to them. That's a CDC recommendation, and it is one of the listed drugs that the state of New York has put on the list and the pharmacist can administer. What the problem was when Shilpa showed up to the pharmacy is that the second barrier occurred, which is the pharmacist could not administer the vaccine because there was no way they can justify or confirm that she was immunocompromised. She was probably taking a medicine, most likely a specialty medicine, that was probably being handled through a specialty pharmacy. And if you go to a different pharmacy, they don't have access to those medication information. So this is the second barrier that Shilpa ran into and she alluded to it, it's a fractured system. We have a system that the patient's information, instead of being with the patient, it is housed within different entities, such as a physician's office, a pharmacy, a different pharmacy, a specialty pharmacy, a hospital setting. So a pharmacist, Shilpa showed up, they can confirm her age, but they couldn't confirm that she was in fact immunocompromised because they couldn't confirm that medication that she was taking causes patients to be immunocompromised. So that was the second barrier. So now we have laws and regulations that restrict access to vaccines for patients. And that's the first step. And New York is not unique. And then you have an additional barrier that because of the lack of information or transferability of the information, access of information between healthcare professionals, they can't go about to even provide the vaccine when the patient is not only eligible, but requires that vaccine. So both of those issues have to be resolved before we get to a point that individuals such as Shilpa, and this is very important because Shilpa is a educated healthcare consumer. She works for a non-for-profit dealing with healthcare issues as a patient advocacy organization. She's done health services research all her career. So she is an educated consumer and she needed the vaccine and she put up with it and she went through the bureaucracy and fought through it and finally got it despite the frustration. 99.9% of patients out there similar to Shilpa are not educated consumers, and they would soon as give up rather than go through all of the hurdles that she went out to be able to conquer, to be able to get the vaccine that was necessary for her.
And Robert, this is not something new. We've been dealing with these battles forever. And I think about before we even heard what COVID was, being in Albany and doing some advocacy in New York and seeing the anti-vaccine protesters. And there's also the idea of vaccine hesitancy is something that is fair and something to discuss. But putting all that aside, who is against vaccine access rather than the vaccines themselves?
So publicly, nobody's against vaccine access, right? Even the anti-vaccine groups, they're not saying we're against the access to vaccines. What they're saying is that vaccines don't work, you shouldn't be taking it. That's a different issue, and they're misinformed individuals out there, frankly. So who's against the vaccine? Nobody publicly about the access, but privately, you have legislation in the state houses to expand pharmacists' ability to immunize. You all of a sudden see state medical societies and certain other entities vehemently opposing it. And the reason they oppose it on the surface is nonsensical because they claim that administering the vaccine is something a physician should be only doing, or only certain vaccines pharmacists can administer. And it is nonsensical because, frankly, administering a vaccine is based on a recommendation by CDC or an FDA-labeled indication. It has nothing to do whether to diagnose a patient. You don't diagnose a patient to administer them the vaccine. So it's not about diagnosis. So who's against it? Publicly, no one. Privately, mostly the state med societies who are fighting vehemently to deny expansion of the scope of or ability of the pharmacists to immunize patients. And as I said, the premise should be that at the end of the day, we should be all about access to vaccines. And the reason being, and Conner, you and I have talked about this, some of the research that GHLF has done, pharmacies, especially in low-income communities and especially for seniors who live in low-income communities, are far more accessible than physician offices. First of all, you don't need an appointment to get to one, but physically they are more accessible because of the hours of operation and the geography that they're located in. So by denying the pharmacist's ability to immunize on par with their physician colleagues, it's just ridiculous, and it's backward thinking by these states that refuse to do so or promote that type of ideology. And to add to the whole mess, our research showed that state of New York, for low-income communities and seniors living in low-income communities, has far better access, significantly better than the average state, for pharmacies than physician offices. So when people talk about access and they talk about equity and they talk about administering it and social determinants of health and all these other things, including health disparities, they talk a good game publicly, but when it comes privately, their actions, especially in support of legislative efforts that does not allow scope of practice for pharmacies or pharmacists to expand and be the same as physicians for immunizing patients, says a lot more, which is very sad and disheartening. And you end up in situations such as Shilpa. Now, Shilpa's situation also had to do with transfer of information. That's another thing and another topic. But as GHLF, our belief is that patients own their data and their information, and they should be able to share it with any healthcare professional that they choose to. As I said, unfortunately in this country, patient healthcare data is commonly hijacked by various institutions, including pharmacies and physician offices and hospitals, and they vehemently guard that information, and instead, an information that should be owned by the patient is owned by entities who then utilize this for various reasons, some good, some not so good. So Shilpa, do you have any words of wisdom for our audience besides reaching out to GHLF and our colleagues such as Conner for patient support? I mean, I know you were probably going to say your word of wisdom is going to be don't give up, but any practical things that you can share with our audience?
Sure. And I don't know if they're words of wisdom or words of encouragement, but also I just want to, before I come to that, I just wanted to say that it was really insightful to listen to what you were saying, Robert, because every time someone told me it's the system, I really didn't understand what that meant. And then when you explained that there are issues around transfer of data, and for example, the pharmacy couldn't even see that I'm immune compromised and that I'm on a specialty medication, which I am. Now I understand what it means when someone tells you it's the system that's not allowing us. So thank you for that. Words of encouragement. Yes, I will start by saying don't give up. Easier said than done. One shouldn't really have to fight to get a vaccine. That onus is not on the patient. But sometimes the only way is to advocate for yourself. And not just advocate for yourself, but advocate loud and make a noise. The reason I'm speaking about this so ferociously, and I'll continue to do so, and I know there are others who have spoken, and I hope more will join my voice here and other people's voices, because we want the healthcare system to know, patients like me, we want the healthcare system to know what is happening. Next time, when we talk about vaccine hesitancy, and by we, I mean our society, let's not forget why some people don't get vaccinated. It's the responsibility of the society to make healthcare easy to access, especially for those of us who are dealing with underlying conditions. If it becomes this hard every time, I will give up on getting a vaccine eventually. I will throw up my hands and give up. We all have enough issues to fight with. We don't need another one, especially not one that has an easy solution. So yeah, my words of wisdom or words of encouragement, don't give up. Reach out to Global Healthy Living Foundation and patient advocacy organizations like us. We will help you. We will support you. And I think the main thing here is to make the chorus louder so that something will change at the policy level.
Certainly some words of wisdom, and truly and honestly, thank you so much for joining us and sharing so candidly the experience that you've had trying to get this shingles vaccine, Shilpa, and you're welcome back anytime. Gonna make sure, as always, Robert, you get the last word in, but what I know is that more access, not less, to immunization and vaccines is not only the most cost-effective preventative treatment, but it's just essential for overall health. And quite frankly, it's malpractice having all these hurdles in place for patients to access these treatments. As Shilpa said, we can't talk about anti-vaccine folks or vaccine hesitancy until we address accessibility issues. But like I said, let's make sure you get the last word. What's your biggest takeaway from Shilpa's journey here?
The biggest takeaway is that don't give up, number one, but most importantly, our position at GHLF is very clear. Pharmacists, who are the most accessible healthcare professional in the community, should be able to administer vaccines on par, similar to what their physicians' colleagues are able to. Therefore, they need to be able to administer any FDA-approved and or CDC-recommended vaccine for adult patients, period. We don't need more stories such as Shilpa because she may have persevered, many others don't. So please join us in advocating that every patient has access to immunization in the pharmacy, because at the end of the day, as Conner said, and as I've said many times, it is the most cost-beneficial intervention in healthcare that we have today.
I couldn't agree more. Thanks for all that, Robert. And again, thank you, Shilpa, for sharing your experience as a patient with us.
Thanks very much for allowing me to share this. And as Robert said, I hope changes are coming. And I hope those changes are changes that make it easier for patients to access vaccines.
Thank you, Shilpa. And to our listeners, thanks for tuning in. Don't forget to subscribe to our podcasts on Apple, Spotify, or wherever you might be listening so you never miss an episode. And if you have a second, help spread the word by rating our podcast, giving us one of those positive reviews, and sharing with your friends and family. It'll help more people like you find us.
If you have any questions, thoughts, or suggestions, you can always send us an email at podcasts@ghlf.org. And We always are looking for new ideas, and we may include you or feature your question in one of our upcoming episodes.
And before you run, make sure to take a listen to some of our other great podcasts on the GHLF Podcast Network. You can find all GHLF's podcasts at ghlf.org/listen. As always, he's Dr. Robert Popovian.
And he's my good colleague, Conner Mertens. See you all next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.